my name is Emily Brown. I'm one of the radiologists working at the hospital. Following the first video, we're now going to be able to perform an abdominal AFAS to try to determine why this abdomen is distended. So at this stage you might want to know how to perform an abdominal FAST. So that is what we're going to see in this video. AFAST is a technique that is based on 4 views. It should no longer take more than 3 to 6 minutes and will allow you to visualize the diaphragm, liver and gallbladder in the cranial part of the abdomen, then spleen and left kidney on the left side, intestinal loops on the right side with the right kidney, and then urinary bladder caudally. Your patient should be scanned either in right or lateral recumbency, and there's no difference in terms of how you're going to be able to assess if there's fluid. You're not going to miss fluid if it's present on either right or left lateral. So as long as your patient is comfortable, choose right or left. As a reminder, free fluid on ultrasound is anechoic, so it means black or dark grey. This is what you're going to do. So first is the diaphragmatical hepatic site, then second systolic site, third interface between liver and right kidney, and then fourth one interface between spleen and left kidney. So we're going to go through this protocol with an image of a normal appearance and an image with fluid. First site is the diaphragmatical hepatic site. You approach this site going under the xiphoid process, and that is to evaluate the diaphragmatical hepatic interface, the gallbladder region, and if you were doing a TFAS, that's also a place where you could evaluate for pericardial sac and pleural space, but we could cover that in future videos. On the left-hand side, you've got a picture of a normal interface between the diaphragm, which is this hyperechoic line, the liver directly in contact, and then the gallbladder. On the right-hand side, you've got the liver, where the liver lobes are separated with some fluids, which is anechoic. Then you move on to your systolic site, where you're going to access the urinary bladder, as you would do when you do an abdominal ultrasound, and that is to evaluate the apex of the urinary bladder. On the left side, you've got a picture where the urinary bladder is normal, filled with anechoic urine. There's no free fluid around it. On the right side, you've got another view where you've got the urinary bladder, which looks intact, and then some free fluids present just cranial to the apex. On the splenorenal sides, that's where you approach the dog with the left flank. Then that's where you're going to see the interface in between the spleen and the left kidney. And you also assess the area between the spleen and the abdominal wall. Again, on the left side of the screen, you've got a picture where left kidney and spleen are normally interposed. And on the right side, you've got a picture where there's a large volume of free fluid. And then the fourth site is the hepatorenal site, so from the right side, where you've got the interface between the right side of the liver and the right kidney. You also have the interface between abdominal wall and these two organs. On the picture on the left, you've got the liver on the left side of the screen and then the cranial pool of the right kidney. And you've got a nice interface in between the two with no fluid present. And then on the right side, there's a little bit of fluid interposing in between those two organs. At this stage, you should be able to perform an abdominal FAST, determine if there's fluid or not, and if there is fluid, then you should be able to with ultrasound guidance, you should be able to access the fluid and retrieve some fluid for analysis, and that is what we're going to cover in the next video.